Only mode.
Good morning and welcome to Partnering for School Health. I'm Michelle Smith, the State Coordinator for Action for Healthy Kids, and this is the first of our webinars for the 2017-18 school year. We put together webinars around the whole child coordinated school health with the Texas Department of Agriculture, the Texas Department of State Health Services, and the Texas Education Agency. And this first one is a really important one about what policies passed this last legislative session and how they will impact you and your schools. Just a few logistics before we get started. Obviously, you can use your telephone or you can use your computer speakers for audio. Everyone is muted on the webinar except for our presenters. So you are able to submit a question in your control panel over on the right-hand side. Down at the bottom, we'll monitor the questions. Anything clarifying for the individual speakers, we'll do at that time, and then we'll also have hopefully a few minutes at the end for any additional questions. We are recording this webinar, so you will get a link either today or sometime this week so that you can share this link if you have others you feel need to know what's going on with the different laws that were passed, or for those that were not able to join us this morning, they can view at their convenience. We will also send the slides as well, the PowerPoint in a PDF file. So look for that in your email, and if you don't receive it, you can always reach out to me and I'll make sure that you get it. So our first presenter will be Jennifer Page, who's the coordinator of special programs with the Texas Department of Agriculture, and she'll update you on what's going on with them.
Thank you, Michelle. The first policy, I guess, and the only one that TDA, the Texas Department of Agriculture, has to report on is the House Bill 725, which provides guidance for schools on increasing awareness about the leftover table or share table. So the leftover challenge, as you all know as school nutrition professionals, must be to prepare and balance enough meals for their student population while managing the costs and food waste. Leftovers can present a challenge even when staff has prepared and planned for meals. So the TDA has recognized these challenges and presented contracting entities with 3 options, and as well as tips to help school nutrition professionals act as good stewards of the valuable resources. So the 3 solutions that are proposed and also with tips are first offering those leftovers as an a la carte option, where schools could sell the leftovers as a la carte options in the cafeteria, and there is specific guidance that follows that option. Second, as a share table, where the for leftovers with other students. And then the third option would be to donate those leftovers to a food bank or other charitable locations. So when we explore those 3 options even more, the leftover sharing tables, they have to follow all local health and safety regulations of the share tables, time temperature control for safety, and making sure that that food is remaining as a safe product when being consumed. And so when we look at the first option of the leftovers as an a la carte option, the price must include the following costs: a value of the USDA food, purchased foods used to make the item, labor to prepare, and overhead cost. When leftovers are on a share table, and so share it, don't waste it, this is to minimize food waste. And so schools can set out a table for students who don't want that item, and others can go use grab items from that table to utilize the leftovers. And with this, same rule applies as contracting entities must follow appropriate state and local health regulations for that. And then the donating option. Schools and other CEs may donate leftover foods to eligible local food banks or charitable organizations. And the key importance to this donating of the food items is it must go to a 501c3 to a charitable organization. And the CE must practice good meal production planning to ensure that they are targeting 1 meal per student. The CE is not able to use the leftover food for another meal service, or the food would be thrown away, meaning that if it can't be incorporated into another meal. And then within this option of donating the items, same as applies with the other two, state and local health codes are followed in storage and transportation of the leftover foods. That is an overview of the legislative updates from the Texas Department of Agriculture on House Bill 725. Following this presentation, Michelle will be sending out the share table brochures that you see on the right-hand side of your screen. And this is just for you to use as a reference or handout for your schools or your school board or even parents to show what schools are doing with the leftover foods.
Thanks, Jennifer. Does anybody have any questions? I don't see anything in the question box. That's pretty clear, and I think it's really exciting that we now have options. Yay.
Thank you.
Okay, so our next presenter is Anita Wheeler, who's the school health coordinator, school nurse consultant for the school health program at Texas Department of State Health Services. Anita.
Good morning, everyone, and thank you, Michelle, for hosting the webinar. I know that for us at DSHS, this has been a really good collaboration in, helping others see what each agency is doing, but also so that we can kind of work together to help inform school districts and school personnel. Next slide, please. So just to kind of give you a little bit of an overview, this session was quite robust as far as how many bills were filed. As you see, there were 4,333 House bills filed, 2298 Senate bills filed. About 700 of the House bills passed into law and about 511 of the Senate bills passed. And this June 21st was the deadline in which the governor could sign, veto, or pass into law without signature any of these bills that you see here. Next slide, please. So here's the bills that we kind of are going to review today in a little bit. There are a couple of them that I certainly will punt to Barney Fudge with TEA, and that would be Senate Bill 1566, but I do want to speak to it just a little bit. In looking at what's here, we've got bills that relate to school nursing practice. We've got bills that relate to the screenings that go on in a school. And then we also have bills related to the auto injectors on private school campus. And I'll give you a little bit of an update of where we are with the epinephrine auto injector rules further on in my presentation. Next slide, please. So when you look at our slide here, you see in the middle of the screen, it says it was vetoed. This is Senate Bill 196. It made it through the House and through the Senate. When it went over to the governor vetoed it. And what this bill did, it defined what a school nurse was, a school counselor, and a librarian. And it stated that schools needed to provide notice if there was not a full-time nurse, counselor, or librarian for more than 30 consecutive days. The interesting thing about this bill was that it does not apply to districts that have less than 10,000 students. And when I looked it up, there were about 111 districts in our state that would have been impacted by this bill. We do have the veto statement by the governor on our website. So if you want to go in and look to see the reason that he vetoed the bill, but I just wanted to let you know that this bill was out there and just for your own information. Next slide, please. So Senate Bill 1566 was one that I actually had a school nurse call me and ask me about the bill. And I had to actually look into it because our agency usually tracks the health bills, and this one is actually a school board policy bill, you know. And so the district is required to develop a policy, and I'm going to let Barney go into that part of it and talk about what TEA is going to be doing with the rules development. But what I want to tell you about this particular bill is that we will update all of our head lice materials. As soon as we know what the new rules are going to be, we'll get sample documents. If there are any of our current head lice information fact sheets that need to be updated, we will update those to align with what TEA is putting into rules and what this law actually says. So I'll let Barney go into more details about what TEA is going to be doing with this bill, or with this law now. It's now a law. But I just wanted to let you all know that we will be updating any of our materials to align with what comes out of the Texas Education Agency. Next slide, please. House Bill 1076, thank you to all the school nurses, including the Texas School Nurse Organization, working with our agency and with other organizations in helping to get House Bill 1076 taken care of and passed and signed by the governor. Basically, what this does is it kind of makes it more, it makes it easier for the agency to change when screenings occur based on what evidence-based practice is out there. So they are in the process of getting the rules completed for this particular bill. They were working on it before session, and now that session is over, you should be getting notification. It should go into effect during the 2018-2019 school year. There will be part of the rule that talks to parent notification, which is a little bit different than what was in the past. We will be giving you as much information through the Friday Beat as well as through the school nurse listserv as these rules come to full circle and are adopted. But we anticipate that's probably going to be, you know, within the next school year, and for sure they will go into effect 2018-2019. For those of you who screen in 5th and 8th grade, the law right now says that you screen in 6th and 9th. So if you previously screened in 5th and 8th, you're still in compliance. If you have any further questions on this particular bill, I can get you in touch with somebody over in spinal screening so that they can answer any additional questions. Next slide, please. So House Bill 3024 added an additional person to who can remove a player if they suspect a concussion. And I see the misspelling. It's not a couch, it's a coach, a physician, a licensed healthcare professional, and a person licensed under Chapter 201 of the Occupations Code. And I did look that up, and that person would be a chiropractor. So they have added a chiropractor to the list of professionals who can remove a student from play in the event they suspect a concussion. Next slide, please. Vision screening, House Bill 3157, adds language to state that the rules need to allow for photo screening to detect vision disorders. I have not heard from the agency when these rules will begin to be drafted, but certainly this is on the agency list of rules. And so certainly as we get more information about that change, we will let you know. Again, if you have additional questions about the vision screening and the vision disorder photo screening, that kind of thing, let me know and I'll be happy to connect you to a person over in the screening program over at DSHS. Next slide, please. Now, this is a little bit off of the normal school health things that we follow, but this has to do with peer review in nursing practice. House Bill 3296, it amends the occupation code related to peer review. And nurses understand that peer review is part of their nursing practice. And they have decreased the number in which an agency that employs, hires, or contracts from 10 to 8. So for some school districts, this may impact what you do. If your district hires 8 nurses or contracts with 8 nurses, they will now need to establish a peer review committee or become connected. I know some of the education service centers serve as that capacity, kind of that coordinating point. I know here in ESC Region 13, there is a peer review committee that kind of works with the schools in here in the area. It's a formal uh, collaboration between the school districts so that there's enough nurses to do peer review in the event they're called to do so. This took effect September 1, and so getting the message out to school districts that hire more than 8 nurses, 8 or more, need to be aware that this is now in effect. Next slide, please. Okay, so let's kind of talk a little bit about where we are in implementation of Senate Bill 66 from the 84th session and Senate Bill 579 for the 85th. Of course, this was a permissive bill, and because of Senate Bill 579 passing and going into law, this now includes private schools. So private schools now are included and do have the immunity part of the law related to the auto injectors. Currently, the rules are under development. There will be 2 comment periods that we want to hear from schools. One will be an informal comment period, and that will probably be within the next 2 or 3 weeks. You'll get a notice that we need your informal comment. It will then go before a whole lot of people over at Health and Human Services to be sent through the process. And then once it's posted to the Texas Register, we will begin to take formal comments through the Texas Register. So we're really hoping that everyone will take a look during the informal comment period so that anything that we can fix will be fixed at that time, so that once we get to the formal comment period, everybody's pretty much okay with what we've got down as far as the rules are concerned. We are in the process of developing a web page with all the implementation resources. That implementation or that web page with implementation resources will go up before the rules are completed. So once the rules are finished, there will be a place for you to go to pick up a lot of implementation resources, trainings, resources for staff, different kinds of forms, those kinds of things. So we're in the process of developing that now. We actually are in the process of formatting everything and trying to get things as easily found as possible on our website. So we will send out a notice once that page is up, even if it is prior to the rules coming out, because we want people to begin to start thinking about what they want to put in place should their school district adopt a policy. And then the other thing we're doing that we should have out there fairly soon is we are going to have what is known as a web form for schools that adopt a policy and have to administer the auto injector. Instead of them sending in paper reports, they will go into this web page and they will put in the information that is required. And then what will happen is that will generate an email back to them that will say this has fulfilled your requirement for reporting to DSHS. So both of those pieces, the web page and the web form, will get information out to school districts prior to the time the rules are formally adopted. Next slide, please. Okay, so we'd like to encourage everyone who has not, done so already, to sign up for the Friday Beat. We want to, keep you updated on all of these things, and that's probably the best way to do it. We put most of these types of pieces of information into the Friday Beat. If the school nurses have not signed up for the school nurse listserv, that would be another way to stay connected with us, because sometimes there's things we need to send out to the school nurses that may not be appropriate for all school employees. So both of those links are on our website, and we would encourage you to sign up. And we also welcome input on the rules process. We work closely with the Stock Epinephrine Advisory Committee in trying to set something that is pretty simple. There are two school nurses, one representing rural and one representing urban districts on the committee. We really do want to hear what's going to be the easiest for you to implement out there, especially in some of the rural areas where your resources are so much more limited. So, definitely get engaged with the rules process, because we do need to hear from you. Next slide. I think that's it for me. Here is my web address. So if by chance later on you need to get in contact with me, here is my email address, so please don't hesitate to contact me. Thank you, Michelle.
Thanks, Anita. And like I said, you'll get these slides, so you will have that access to that email address, so you don't have to worry about not having that. All right. Our next presenter is Barney Fudge, who's the statewide coordinator for student health and safety with the Texas Education Agency. So I will turn it over to Barney.
Good morning, ladies and gentlemen. And again, as my colleagues have already iterated, big thanks to Michelle for hosting this. We greatly appreciate her doing so and helping us continue on with this collaboration. This slide on this page basically is just our copyright notice and talks about the presentation can't be reproduced without express written permission from the agency unless you meet one of those 4 criteria. Next slide, please. And then also, a lot of the communications that I send out are on the school health email distribution list. And to join one of those lists, you could go to this web link right here. Next slide, please. And then you can select the health and physical education listserv, anything pertaining to health education, physical education, school health, school safety, TEACS review, school health survey, Fitnessgram, all things will be sent out on that health and physical education listserv, as well as you can also join any of these other distribution lists that are available if you would like to receive information from them as well. Next slide. And today what I'm going to talk about is a very limited list of bills that I was tracking that pertain to school health and safety. The PDF that Michelle will send out will have significantly more bills on there than what I'm going to cover, just because time wouldn't permit so. So if you do have any questions about the additional information that is on the handouts that Michelle will be providing, my contact information is on the very last slide, and just either give me a call or shoot me an email. We're also going to talk about Fitnessgram as well, school health survey, the new prescription drug health TEACS that were adopted, and then just kind of give a brief update on the health and physical education TEACS review. Next slide. So the 85th Texas Legislature, Anita already told you how many bills were filed and how many bills were passed. And on TEA's side of that, I did over, I was tracking over 200 bills. And out of those 200 bills, I did 37 analyses. And I think out of that 37 analyses, 15 or 20 of them at least passed. But the first one that I want to talk to, that amended Government Code 662.111, was House Bill 822, and it basically designates April as Sexual Assault Awareness Month. And for those of you that are wondering, April is also Alcohol Awareness Month. So now it's also going to share that with being Sexual Assault Awareness Month. Next slide. House Bill 1645 amended Texas Education Code 33.093. And I wanted to include this one in there because I thought this was really a neat bill that especially touched my heart. Is that School districts that allow students to participate in Special Olympics also provide them the opportunity to earn a letter on that basis. So if the district allows high school students to earn letters for academics, athletics, or any other kind of extracurricular achievement, then they must also allow a high school student that's participating in the Special Olympics to earn a letter for their sport as well. And I thought that was really cool that passed. Next slide. Senate Bill 489 gives more an additional responsibility to school health advisory committees, and basically what it does, it adds to the SHAC's responsibilities of recommending policies, procedures, strategies, and curriculum that's at the appropriate grade level to provide instruction in preventing the use of e-cigarettes and tobacco. So that is a new responsibility that's been added to school health advisory committees. Next slide. Senate Bill 1873 amends Texas Education Code 38.0141, which is actually the legislation that states the agency shall collect certain information through a school health survey. So this information requires us, in addition to collecting the information in the school health survey, it mandates that the agency provide a report not 1 year after we collect all the information about student health and physical activity, and that we've got to post it on our agency website. Next slide. And it gives very specific details on what the report should include. So we're going to collect this information in two different ways. The first set of questions that are information that's required for us to collect, I'm going to go over that we're going to collect it through PEAMS data, and then the final questions, and I'll specify which ones are actually questions that were added to the school health survey itself to collect that information, and then we'll pull it together, and then that's what we will use to produce the report. So through PEAMS, we're going to be collecting the number of physical education classes that are offered at each campus in the district, and detail the number of days, classes, and minutes that each class is offered, or each week that's offered on each campus. We're also going to collect the ratio of students enrolled in physical education classes in comparison to the overall enrollment. And then what is the average class size for each physical education class within a district? That's information also to be collected through PEAMS. Next slide. And then through PEAMS, or actually I think this would come from the State Board of Higher or SBEC, I think. The number of physical education teachers in the district who are licensed, certified, or endorsed by an accredited teacher preparation program to teach physical education. So my guess is they're wanting to find out how many people are certified versus how many people, maybe teachers' aides possibly, that are assisting with physical education. And then whether so that would be the final one that would be used through PEAMS. And then this next set of questions is actually what's been added to the school health survey, whether each campus in the district has the appropriate equipment and adequate facilities to provide the amount of intensity of required physical activity. Next slide. Whether the district allows modifications or accommodations for physical education courses to meet the needs with students with disabilities. And I was kind of confused as to why they want to collect that information, because that's already required by federal law. If you have a student that has a physical disability or limitation or an illness, by law, by federal law, you have to make an accommodation or a modification for that student. So I was kind of confused as to why they're wanting to collect that information. I guess maybe to see if all districts are in compliance with federal law. I'm not really sure. I was kind of hazy on that part of it. And then the last question that we added to the survey were whether the district has a policy that allows teachers or administrators to withhold physical activity as a form of punishment. So that's the last three questions that would be added to the school health survey, which I will further discuss here in just a moment. Does anybody have any questions over any of the legislation I just covered?
Haven't had any questions on anything yet today, Barney. So if you have,
Alrighty.
be sure and submit those.
Okay, moving right along then. Fitnessgram. All right, so with Fitnessgram, if you go previous slide, please. We're everything has been closed out for the 16-17 academic year, and everything currently as of August 31st, all districts in the state of Texas do not have access to Fitnessgram. Fitnessgram is officially online because that ended the 2-year cycle for funding. We are now entering into our next 2-year cycle of funding for the 17-18, 18-19 academic year, and all things have been routed for approval. Excuse me, which basically means it's out of my hands now, and I'm at the mercy of everybody else that is routing it through the approval process. But the system won't go online until the contract is actually signed by the vendor, and then once that happens, information will be sent out on the school health email distribution with where you need to go to opt in for the site license. So districts, just like we did 2 years ago, will have to opt in again to take advantage of the free software license for the next 2 years. Other information that was sent out this year also is that the Physical Fitness Assessment Initiative application, which is what I refer to as the old school way of providing information or your Fitnessgram data to the agency, where it uploads to the agency directly, that application is no longer on the TEAS website. It is now moved to TEAL. And there was an email that was sent out on July 13th mentioning that change from TEAL to TEAS. And so if you don't want to take advantage of the free software license and you still want to input your data through what I refer to as the old school way, you will now have to set an account up for PFAI on the TEAL listserv.
Hey, Barney, I'm
yes.
not sure you may have answered this. When should we expect teachers to have access to Fitnessgram software?
As soon as the contract is signed.
Okay, thanks.
Which translates into hopefully as soon as possible, because I routed everything in July for approval. Okay. So I'm hoping relatively quickly. The Excel spreadsheets for the 15-16 and 16-17 academic year have been posted to the Fitness Data webpage. So that includes all schools that reported through PFAI, as well as the Fitnessgram web-based application. And hopefully within the next couple of weeks, we will also have the written data analysis report posted to the website as well, so folks will be able to see the data that was reported, and then also be able to compare that to the written analysis that was provided to us by the contractor. This is just some comparison data for now compared to 15-16 and 16-17. You can see that districts, obviously, more districts used the online version than they did the PFAI version. And then just the total number of students also were down from last year to this year by about 400-something thousand difference. Next slide. School health survey. The 2015-2016 school health survey results that assess the previous academic year, which would be 14-15, that data, the aggregate data, statewide data for that has been posted to the website, and we are still trying to get the 16-17 survey out. Like I said, we had that ready to go, and then that bill was passed into law, so then we had to add those 3 additional questions. So that has been done. The survey has been routed for final approval. And then once it's been approved, the only step from there is for that to go in front of our data governance review board to get the blessing of me being able to post that survey and send it out. So I'm hopeful that that will go out at some point this fall as well. Next slide. From the previous legislative session, the agency was required to develop prescription, or the State Board of Education was required to develop prescription drug health, Texas Essential Knowledge and Skills. And that has been done, and those changes to the health TEKS have been approved. Next slide. And this is where you can find that information. You can find it on the rules adopted but not yet effective page on our website, and that is for subchapter B, which is middle school, and then subchapter C, which is high school. So if you click on that link that's listed right there, that will take you straight to the page that you need to go to, so you can see those TEKS that were added for instruction about prescription drugs. And the second part of that bill required us to research and recommend evidence-based practices and programs, and we're at the final stages of that research, and we hope to have that information posted sometime soon as well. Next slide. And health and physical education TEKS review. This review in the 5 years that I've been here has been bumped twice, but at the June meeting this summer, I believe, or maybe it was the April meeting prior to that, I can't remember, but the schedule was reapproved again. Next slide. And so in the spring, late spring or early summer of 2018 is when the TEKS review for health and PE will begin. The State Board of Education has adopted a new process, and but as far as the public is concerned, there will still be an application. So once this is ready, it'll be posted on the TEKS review page. I will also send out communications about it as well. I'm pretty sure that there will be a to the administrator address letter that will go out discussing the application for TEKS review for health and PE. And so we'll be collecting applications, and you'll have to fill out that application, provide some additional information, and then that information will be organized by your State Board of Education district that you reside in. And then those applications will go to those specific board members, and then they will select who they would like to represent on the health and physical education TEKS review. So part of the process is still the same, but then part of the review process itself is a little different. So with that being said, April of 2019 is when we would expect the state board to adopt the revised TEKS. And then that spring or summer of 2020 is when professional development would occur to let everybody know, hey, here's what's been adopted. This is what the changes are. And then I'm sure at that point there would be a call for materials as well. So then there will be new textbooks that will be adopted. And then the implementation of the health and PE TEKS will be the 2020-2021 academic year. And that's all I have, folks. Right there is my email address. And then if you have any questions, need any follow-up, please don't hesitate to give me a shout, because that's what I'm here for.
Thanks, Barney. It's kind of amazing. This was a difficult session, and looking back to see we actually did pass some legislation. There was a fear at one point that nothing was going to be passed. So some of those were fairly significant. I'm having issues with my screen going away when I click on questions, so you're just going to have to bear with me on that. Back to the first presenter. I'm reading, but I can't figure out what HB 3157 added to what is already being done. That be Jennifer?
Mine was House Bill 725.
So 1357. Anita, did you have anything on that?
No, Michelle, I didn't, I don't think. Let me look. Hang on just a second. There's House Bill 3157. Is that what they're talking about?
What was that relating to?
If it's talking about the vision screening,
yes,
the rules.
Yes.
The rules will include what to do with the photo screening that has been going on for some schools. So if it's 3157, new rules are being adopted for that.
So there's nothing published yet as to what the difference is from what is now, but there will be some.
Well, primarily right now it's not written in there that they can actually use the photo screener. Okay. And so, right now it's just the cover test, the tumbling E or the H, the other screening test. So this will actually put into language what they need to do with the photo screener, because it's not really written in there right now.
Okay, that makes sense. And Bob noted that this is the first update since when? 1998. So yes, that is kind of exciting that we finally have a plan for updating the TEKS. Any other?
Well, and Michelle, let me add to that kind of timeline I went over is still a tentative timeline. The state board has the authority to change that timeline at any point they deem necessary. So hopefully it'll stay the same, but if they change it, they have the authority to still change it.
That's true. Good point. A question: what is a photo screener, Anita? Specifically.
A photo screener is an apparatus where the children can look into this piece of equipment, and it really can detect a lot more than just the cover test. It can kind of look at how the eye is working, functioning, et cetera, et cetera. It can pick up more things that may need to be referred to an ophthalmologist. And so it's a piece of equipment that really does more of a screening as it relates to eye muscle movement, nearsightedness, farsightedness, those kinds of things. So, it's something that usually is used in the younger children because they're so hard to screen using the patch cover tests that are available. So this will kind of give direction on how that should be used when you're doing the required vision screenings for schools.
Okay. Who will qualify for the H&PE review board? Will they need to be teachers, professors? What type of individuals? Barney?
It's open to the public. I know one of the changes that was made is that there will be what the state board considered a panel of experts first that will review the TEKS and will make recommendations about the direction that the groups that will be making the revisions will need to go. But again, I mean, it's open. I mean, they're going to want a cross section of teachers, educators, administrators, professionals, professors, possibly. So it would be open.
I think I honestly, as a parent, participated back in 1998 on the review panel. So They do take a cross section. It's not just certain types of people, teachers even. So, okay, I think that was the last question. Quickly, Action for Healthy Kids is working on more webinars. You can check our Action for Healthy Kids site for the details. We did send out a webinar email that had all of them listed. There are some on coordinated school health with the Partnering for School Health webinars, and then there are a series for school health advisory councils. So check those out. Also, mark your calendar for February 9th. We will get registration open sometime this fall for the annual summit. This year it will be in Houston. So we will be at the United Way Center in Houston on February 9th. And we have secured, with the support of Department of State Health Services, thank you, Anita, Marlene Schwartz from the Rudd Center, who is a well-known nutritionist, and she will be our keynote. And we have a lot of other great sessions that are in the works. So if you're not on our newsletter list, you need to sign up so you can keep posted on that. And then really exciting news, Action for Healthy Kids nationally has worked with the National PTA to develop a website for parents around school health. So there is a new website called parentsforhealthykids.org, and you'll find information on everything from recess to school meals to fundraisers, an opportunity for parents to network, to ask questions. So I'm real excited about this new website and think it's going to be a great opportunity for parents to get together and learn more. So there's that. And then also, if you're looking for videos on specific topics, we have posted videos for the last several years, webinars on YouTube under Healthy Kids, Healthy Families. So you can go there and find, for instance, if you're really interested in all the laws that pertain to school health advisory councils, we did a session last spring on that that's posted. If you're interested in SEL, if you're interested in getting parents engaged, there are a host of different webinars on there that could be of use to you. So be sure and check those out. Next week, just a note from Bob, next week is Take Your Parent to PE Week. So if you, I don't know what the deal is today with my computer and the webinar. Let your schools know that they should bring their parents to PE next week. So thanks, Bob, for that quick note. And with that, we will give you back a little bit of this hour if there are no more questions. Thank you for joining us, and check your email for future information on this webinar and others. Have a great day.